My name is Paige Shumway, and I live in Corvallis, Oregon, and I am self-employed and uninsured. And I have two children, one just leaving school age, one 13 and one 18-year-old, just turned 18 in July, and I'm married. And I've had a lot of varied experiences with insurance or the lack of it, and right now that situation's changing again, as I have a son who just turned 18 and is now falling off of our pieced together Oregon Health Plan coverage, and now will be not covered by the Oregon Health Plan. And we just got back from a trip, and he had his birthday during that trip and turned 18, and we had to come back to postpone scheduled 4 impacted wisdom teeth that needed to be removed. And we were covered on the Oregon Health Plan for the 4 months before that we were scheduling appointments to have the surgery done, but they postponed and postponed doctor's appointments until he turned 18 while we were on vacation, and the surgery was rescheduled for when we got back. My husband had originally had insurance very good insurance through Hewlett-Packard while he worked there, but through their downsizing, we weren't able to hold on to that insurance for as long as we could have, and we've had lots of experiences without insurance at using backup programs locally, like the Sunflower House here in Corvallis is a wonderful place for no income or low income people to get their health care, but you have to sit in a waiting room for, no exaggeration, 2 to 6 hours. You're really at the mercy of the system, and we'd already gone through earaches and strep throat and lots of things where we actually didn't go in because the children, after 2 times of that, wouldn't go sit for 6 hours just to be told they were sick. They wanted to ride it out, and it's hard to argue. And so we petitioned again to be on the Oregon Health Plan this last year, and right before the dental work needed to be done, we were able to get the children both on it. And we've gone on and off of the Oregon Health Plan because we are a 2-income family. We can qualify and disqualify month to month based on our income. Most things have to be treated like an emergency room, almost everything. So most of the time, what we've learned to do over the years is to wait for the earache and go to Sunflower House or go get an appointment because we might qualify that month for the health plan, and bring the child and have a list of things we also need looked at. We take care of my husband's mother, who is alone and owns her own home and is aging and living in her own home and needs round-the-clock care. And we have nurses and caregivers that stay and take care of her. And the caregivers brought her to an appointment about a month and a half ago, and they wouldn't see her at the clinic, and we didn't understand. She's insured. We transferred everything to Medicare, and they turned her away after 40 years of going in Corvallis, right? And it took several phone calls, and it turned out it had to do with that they weren't seeing anyone on Medicare anymore. And now we're not quite sure how to go about that, because we made sure we transferred everything to Medicare so that she could qualify for things and get the coverage she needed. And we're still researching, okay, now she's not comfortable just going to any doctor. She's had 40 years, with the same 2 doctors, and so having to see a whole new set of people on the last year and a half of your life, is really brutal and very hard to explain to her as well. It took a lot to get all of the paperwork changed over to talk her into doing it, and now they won't see her. I would very much love to see a more universal, or even locally universal, healthcare offering to the public that cannot afford it, and not have it be attached to your job. I don't think they should have anything really to do with each other in that respect. I think everyone deserves to have a right to health care, and that I don't know how to have a healthy country and a healthy culture if we don't set the standard of expecting that and providing it, however that means we can come up with to do it. Yeah. Thank you. You're welcome. Thank you.